One of the benefits of using VitalStimPlus is the possibility of using more than 2 channels at the same time. While many dysphagia treatments will utilize the standard 2 channels attached to the 4 electrodes, some situations may benefit from utilizing more channels. For instance, one can imagine wanting to deliver stimulation to the oropharyngeal sling through 2 channels focusing on the buccal branch of the facial nerve on both sides of the face, while at the same time stimulating the tongue through the 12th cranial nerve through a 3rd channel that is set up below the chin. Let's set up our patient to show you how this works. We are now attaching channels 1 and 2 to both sides of the face over the buccal branch of cranial nerve number 7. The nerve runs more or less along a line between the ear canal and the corner of the mouth. The bottom pair of electrodes will be placed over the nerve location right between the hyoid bone and the mandible towards the back of the mandible. This will help facilitate tongue recruitment. So for this patient, we are assuming he has a need for facilitation of the sling to promote mouth closure and buccal tone to decrease spillage and pocketing. He also needs facilitation of the 12th cranial nerve to help with his tongue motility. Let's turn on the unit and select VitalStim. You can see in this great treatment review area that the standard VitalStim parameters are going to be delivered, which is what we want. All we'll change is the treatment time. Let's make that to be 30 minutes, just to show you how that's changed. Now let's select channels 1, 2, and 3 by touching the icons on the screen. First, increase the intensity in channels 1 and 2, and have the patient provide feedback on how that feels. Most patients start feeling it right around 3.5 or thereabouts milliamperes. We need to go a bit higher than that until he feels a contraction. In this case, he will feel it right around 5 milliamperes. Once channels 1 and 2 are set, let's do the same thing for channel 3. You can see that the time is now running and the VitalStim protocol is delivered through all 3 channels at the same time. If during the treatment there's a need to pause the session, just press the Start Pause button and the current flow will stop, and then press it again to restart. Pressing the Stop button will stop the session. After confirming, the treatment summary screen will appear, and you can save this treatment to a micro SD card if you wish to export the data to a PC. Now, before we disconnect our patient, let me show you how to tweak the delivery of this session and make it a bit more timed to the patient's activity. For this, we are going to use the remote control. Connect it here in the middle at the top of the device. Now press on VitalStim again. The first thing you notice is that the timer is now no longer active. This is because we are going to be delivering stimulation only when we press the button on the remote. Let's again select channels 1 and 2 and 3 and increase the intensity to a therapeutic level. The current is now running continuously. To start this manual mode, press the button on the remote just one time, one click. The channel shows that the unit is running but no current is actually flowing. Now we instruct the patient to swallow hard and strong, and when she feels the current coming on, to do the effort. Are you ready? Let's go. And now the therapist, while she presses the button, will have the current flowing and let go as soon as the patient is done swallowing. And that is it. Another easy, powerful feature of the VitalStim Plus.